Well, speaking of flu season, let's bring in Avajoy Burnett right now. We have been talking a lot about the so-called Twin-Demics, the flu and the coronavirus at the same time. So, Avajoy, I understand you explained that doctors at Johns Hopkins are urging all of us, this year in particular, to get our flu shot.
You know what? The pandemic may be that one thing that may urge people to get a flu shot this year, and here's why. Officials are saying there may be some confusion between the flu and COVID-19 once those symptoms continue to develop because they're so similar. So once again, they're urging people to get a flu shot just to rule that one out. The coronavirus and the flu may meet at a dangerous crossroads this fall. They're being dubbed the Twin-Demic.
We're looking at two pandemics occurring at the same time here.
Here in Maryland alone, hundreds of people have been hospitalized because of COVID-19. Researchers say when you add influenza to the mix, that could be a dangerous recipe.
This may put an increased burden on our COVID-19 testing infrastructure, which has already been a little stretched to the limits because individuals suffering from influenza may think they're infected with COVID-19 and search out tests for COVID-19 with their healthcare providers.
For some encouraging signs, just look abroad. The southern hemisphere emerged from their flu season with low transmission rates. But researchers at Johns Hopkins say it could be that people there were taking the advice of wearing masks, staying at least 6 feet apart, and getting a flu vaccine. Steps they say people here need to continue to take.
And now is more important than ever that people get their flu vaccines.
There are a few things to look out for if you're trying to determine if you have COVID-19 or the flu.
If you're starting to feel respiratory symptoms, and if they're starting to get a little severe, if you're suffering from shortness of breath or feeling very, very weak, first and foremost, contact your doctor, your local healthcare provider.
And doctors are now looking into this phenomenon known as co-infections. This is where, if you can imagine, that someone gets the flu and COVID-19 at the same time, but they say the evidence on that right now is inconclusive. Live tonight at 6, Avajoy Burnett for WJZ.